As we move into our 30s, we start noticing these brown spots or sun damage. Some people refer to them as liver spots. This is normal to notice as we get a little bit older. The pigmentation that we see in our 30s has been there for a long time. I like describing it like an iceberg. We see the iceberg tip above the water, but the iceberg is miles and miles deep below sea level. My name is Chantal Ward, and I'm a registered nurse specializing in medical aesthetics. I'm here today to give you all the information you need so you can make sound decisions for yourself in your anti-aging journey. These changes or brown spots that you're seeing is a cumulative effect of exposure or skin injury. So when you were in your 20s or your teens, or even as a child, if you had sunburns or you used to lay out in the sun, back in my day, we used to slather up with baby oil, and the darker we got, the better it was. Well, the years catch up with you. So sun protection at an early age is so key in preventing sun damage as we age. While these effects may appear suddenly, these have been happening for quite some time. And one day you look in the mirror and there you see it. So there are intrinsic factors, so your ethnicity. So if your family is of Celtic descent and they're very freckly, you are most likely going to end up with that type of pigmentation as well. Or externally, extrinsic factors such as sun exposure without sun protection, acne scars, hormonal changes. There's so much going on that basically triggers that sun damage to be visible one day. Identifying a history with my patients and understanding kind of lifestyle, what they've been doing, will actually help me decipher what is the best treatment option for that pigmentation that's popped up, that post-inflammatory hyperpigmentation, which could be redness after a whole bunch of breakouts, or even melasma. There are options, but I really need to kind of understand and do an assessment or consultation and have a look at your skin to really see what kind of sun damage or damage you have. If it's truly sun damage, you've been exposed to UVA, UVB rays that injure the skin cells and actually stimulate that melanocyte to overproduce. And as it overproduces, it destroys those cells and it leaves these little clusters of pigmentation below the skin. And as we age, they start creeping up higher on the epidermis. The other reason why individuals may see pigmentation on their skin is because of hormonal changes. If you're a young teenager and you go on birth control, you get influxes of estrogen and progesterone. Those hormonal fluctuations can actually stimulate those melanocytes to overproduce, and you get what's called melasma. And that melasma may show up on the forehead. It may be kind of the lateral cheek. It also occurs in women who are pregnant. They call it pregnancy mask. So you've got sun exposure, you've got hormonal changes that are happening, and then you have pigmentation that can show up after an injury to the skin. So severe acne, you get that redness after you heal. You can get the brown or hyperpigmentation. So it goes from red to brown. So there's a number of things that are happening that can cause this pigmentation on your skin. So the key thing that we're doing as healthcare providers is really understanding, what is it? Why do you have that pigmentation? The other factor that all of those things are affected by is your skin renewal. As we get a little bit older, as I've mentioned before, we lose our collagen by the time we're in our mid-20s. It starts depleting or decreasing. Our skin renewal or our cell turnovers start slowing down. So someone who does not do good skin or medical grade skincare, or they don't do a retinol or a retin-A, or they don't go for mechanical microdermabrasion or oxygeneo treatments or these advanced facial treatments. They have a more sedentary skin cell turnover, if lack of a better word. When we look at all of these pigmentations that can occur, as a clinical technician or a nurse in the aesthetic field, I'm going to marry up the right combination therapy so that we can actually get the best result. The first thing I'm going to do is assess your skincare. What is it that you're using? Are you using a retinol to help cell turnover? Are you using a good antioxidant such as a vitamin C? Are you moisturizing? If you have been prone to acne, the biggest thing that acne patients do or clients do is stop using moisturizer. Wrong. Don't do that. You need the moisture more than anybody to keep the cells healthy. And lastly is using a really good SPF that is non-comedogenic or oily that's going to clog your pores. That's going to be number one. Number two is I'm going to marry up the right technology. So are we going to do an IPL or a BBL? What that does is if you have on the surface of the skin, if you have pigmentation here, we know that it's going to be much deeper below the surface of the skin. IPL has a light that's attracted to red and brown. It's going to be focused, or it is going to be absorbed by that brown or red spot, and it's going to break up that pigmentation so that it almost turns like a coffee ground and it sloughs off. Okay. Now you're going to be left with fresh, maybe even the pigmentation will be gone, or you might have a pigmented lesion that becomes a little bit less dark. Okay. The next thing we're going to do is we're going to make sure that we have you on a protocol where we're doing a series of treatments. Now, that might be IPL and BBL, it might be microneedling with radiofrequency, it might be microneedling with exosomes. Exosomes have been a godsend or an amazing treatment for pigmentation, not only for sun damage, but also for melasma, that hormonal pigmentation. The next thing that we would look at is maybe you are a candidate for a chemical peel. Darker Fitzpatrick skin types, or if you have a naturally darker skin tone, lasers may not be the right choice for you. So you have to trust your healthcare provider that they're going to either have the right technology for your skin tone, or they're going to steer you in a different direction, such as microneedling, which would be safe, or chemical peels. Those glycolic peels actually help that cell turnover, break up the pigmentation, and it's definitely going to be a series of treatments to get optimal results while you're using your at-home skincare. Remember, you're going to use an antioxidant, you're going to use a skin brightener, a moisturizer, and an SPF. The types of peels that we do could range from glycolic, we could be using TCA, or we could be doing salicylic peels. There are different ones for different depths of penetration, and depending on how you present, we will choose the right chemical peel for your skin type. If someone has tons of sun damage, they've lived their entire life on the beach, their skin almost looks leathery, we may choose a more aggressive type of approach, such as a fractional CO2 laser, where it actually vaporizes the tissue from the top down. It breaks up pigmentation and it really enhances that cell turnover or that skin to turn over. Definitely you'll need at least 2 to 3 treatments, but you might be a one and done type of person. But again, your healthcare provider or your technician will be able to give you the best protocol for your skin and how you present. For 2024 and 2025, there's been some advancements in laser technology. There's PicoWay, PicoSure. These are in the Q-switched YAG, very similar to tattoo removal machines, But what they've done is they shatter pigmentation and vibrate. They do what's called a photoacoustic, and it is a technology that is incredible for breaking up pigmentation on all skin tones and colors. So not everybody has this technology, but if they do, they might ask you, or they might put a protocol together where you're going to do chemical peels and you're going to do skincare as well as this Pico technology. So there are some really great changes that are happening in our marketplace. I've mentioned exosomes. Exosomes are these vesicles from stem cells. They can be plant derived, they can be human derived. Keep in mind, human derived are not approved in Canada, but they are in the United States, and they can only be applied topically after you've injured the tissue doing microneedling. Now, there's a lot of talk about this salmon sperm facial. Well, salmon sperm is not what you think. It's called polynucleotides. These polynucleotides are derived from salmon sperm, just like antibiotics are derived from fungus. So what's nice about these polynucleotides is that they are inflammatory inhibitors, or they down-regulate or slow down those melanocytes from overproducing. I have not worked with it yet, but some of my peers have told me that they're getting great results with pigmentation change. They're using this after microneedling. They're applying it onto the skin. In the Asian market or internationally outside of North America, they are injecting it. It is not approved for injection in the United States or in Canada. It can only be used topically. So be mindful of that. But it is something that, again, is developing, and we're seeing some great changes in this exosome polynucleotide kind of regenerative type of treatments for both anti-aging and pigmentation. In conclusion, the best remedy is prevention of sun damage or pigmentation. However, if you do have it, we can treat it. We can treat it with, you can prevent and maintain and keep healthy skin by using medical grade skincare. We can do targeted chemical peels. We can do laser, both light energy as well as radio frequency energy. We can use PRP, or we can use these exosome type technologies in combination with microneedling. There are options. So again, trust your healthcare provider that they're going to set you straight, help you come up with a treatment plan that fits both your time and your budget to get best optimal results. Again, I want to thank you very much for watching my video. I'm going to ask you to give me a thumbs up and subscribe. And if you have any questions, feel free to put them in the comments or DM me. Have a great day, and we'll see you next time.